Hi, my name is Rylan, and I have orders today to insert a Foley catheter for Mrs. Charlene J. Knight, date of birth 8/8/1939, and her allergies are latex, penicillin, and betadine. And our orders are to insert a Foley catheter, size 14 French, for urinary retention because she hasn't urinated in the last 10 hours. Hi, Mrs. Knight. My name is Rylan. I understand that you haven't been able to urinate in the last 10 hours, so we have orders to insert a Foley catheter here. If you could go ahead and just verify your name and date of birth. I have Charlene J. Knight, date of birth 8/8/39, and her allergies are latex, penicillin, and betadine. At this time, I will be assessing her peri area to see if I need to perform any peri-care prior to the insertion of the catheter. Alright, so I don't see any redness, swelling, or lesions, or any visible soiling. I've visualized the urinary meatus, and I'm going to palpate the bladder. I'm noting bladder distension. Ms. Knight is clearly uncomfortable. We're definitely going to be inserting the catheter, and I don't need to perform peri-care at this time. Everything looks good. So I'm going to set Mrs. Knight up here. Get her ready to go. Make sure that my field is ready to go here. Okay. Hand hygiene. Okay. So, I'm going to move the catheter from the bag. I'm going to use my plastic as a trash can. Okay. And I'm going to open up my sterile field. So, making sure that I'm only touching the 1-inch margins, I'm going to open the outer flap first, then the flap to the left, the flap to the right, and finally the flap closest to me. And the whole time making sure that I'm facing my sterile field, that I'm only touching the 1-inch margins, and that I am not reaching across my sterile field. Everything is ready there. Now I'm going to get my drape ready to go here. So I've got my drape. I'll take a step back, and while only touching the 1-inch margins, I'm going to open up my drape. Alright, drape is ready. I'm going to place the shiny side down in front of Mrs. Knight here. Make sure that's nice and open there. Alright, here we go. Again, making sure that I'm only touching the 1-inch margins. Okay? And now I'm ready to put on my sterile gloves. So I'll do hand hygiene one more time. And making sure that my body still faces my sterile field, I will don my sterile gloves. This time I'm being extra careful to make sure that when I open up my glove packaging, that my sterile field from my gloves does not overlap the sterile field from my catheter. Again, only touching within the 1-inch borders. With thumb out, now supinate my hand and get my right hand. Okay? Don't need that anymore. Maintaining orientation towards my sterile field. My hands are sterile, I can now work within my field. And the first thing I'm going to do is take my package of hydrogen peroxide, take a step back, tear it open, and pour hydrogen peroxide on my cotton balls. Discard that. Next I will take my package of lubricant, take a step back, tear it open, and pour the lubricant in the proper container, and discard of that. Next I will exercise my plunger. Take a step back so as to make sure I do not spray water everywhere. I will exercise the plunger. I'm going to attach my syringe to my port here. Hang on here. Make sure I get everything situated. Next I'm going to take the tip of my catheter and I'm going to lubricate it. Okay, it is lubricated. And now I can transfer my sterile field from the bedside table to the patient. Okay. Alright, so I'm going to prepare to cleanse the peri area. So at this time I will contaminate my left hand by spreading the labia. I will take my right hand, which is still sterile, and I will clean the farthest labia majora, come around, drop it off. I will cleanse the closest labia majora, come around, drop it off. I will cleanse the furthest labia minora, come around, drop it off. I will cleanse the closest labia minora, come around, drop it off. And then I will cleanse down the middle from clitoris to anus, come around, and drop it off. And so I finish my peri-care and get this out of the way, making sure that I'm still facing my sterile field at all times. And now we can prepare for the insertion of the catheter. So I'll tell Miss Knight to go ahead and take a deep breath and bear down for me. And I'm going to make sure that my right hand, which is sterile, does not touch the skin, or my left hand, which is contaminated, and same with the catheter. I want to make sure that it does not touch any skin, and it does not touch my left hand. Here we go. Alright, so I see urine. I'm going to insert another 1 to 2 inches. Okay, I'm going to take my left hand and hold the catheter. I'm going to take my sterile right hand and inflate the balloon. Okay, the balloon is inflated with 10 mLs of sterile water. You can disconnect the syringe, place that over here, and at this time my sterile procedure is finished. I'm going to take this out of here. What I would do now is I would hang the catheter on the bedside frame, come down under the lid, and I would be monitoring strict eyes and nose for Mrs. Knight, and I would be assessing the coca of her urine, the color, the odor, the consistency, the clarity, and the amount. And we would be performing peri-care regularly over the course of our shift. Again, assessing eyes and nose. And making sure Miss Knight is comfortable. Put this back. That. Put the rail up. and lower the belly. And the procedure is finished.